Hi, I'm Kevin Harrington, an original shark from the hit TV show Shark Tank. And with me is Dr. Michael Gray with Keller Disc and Spine. Dr.
Hi,
Gray,
Kevin.
good
How are
having
you? It's
All
my
right.
pleasure.
Fantastic. So now you've been in chiropractic medicine for 36 years.
Yes,
I
sir.
know the last number of years you've been focusing in the regenerative arena, which is very powerful. And so tell me, how did you get started and what is driving you now in the regenerative side of the business?
That's a great
Excel,
point.
okay.
Yeah, yes. Well, we integrated our practice several years ago, and we brought in medical doctors and nurse practitioners, anesthesiologists to offer our services, more services to our patients.
Nice.
In that process, I was introduced to stem cell therapy. I was my first patient.
Okay. Wow.
So I've played 40 years of racquetball over the years, and in 40 years I destroyed my knee. So I was facing knee replacement surgery.
Yes.
Tore meniscus, torn ACL, lots of arthritis.
Wow.
And decided to do stem cell therapy instead. So 6 months after my injections, I was able to get back on the racquetball court. Wow. And it's been 2.5 years now, and I'm essentially pain-free, playing racquetball again, and got my life back.
So you focused on yourself. It was a huge victory, and now you're focusing on all the other patients that are out there. You're in the Dallas, Fort Worth area.
That's correct.
And so I'd love to hear beyond yourself. You've obviously, you're a testimony to your own success.
Yes, sir.
With your practice. Tell me about some of the other folks that are coming in. I mean, today's world, there's a lot of pain out there, right?
I mean, you've got patients coming in with sports injuries, with old age, car accidents,
right?
degenerative conditions. So some of our patients, for instance, we had the benefit of treating 2 Olympic athletes,
Nice.
40-year-old and a 51-year-old, that both compete in the U.S. Olympics against 20-year-olds.
Okay.
So we did both of their knees,
Nice.
allowed them to compete and move on.
No, go ahead. Yeah, please go ahead.
So that high-level achieving athlete, and there are really an untold number of professional athletes today that are having stem cell therapy, really cellular therapy, regenerative injections done.
And as an integrative clinic, you mentioned you have an MD, you have the nurse practitioners, you have the anesthesiologist. This is to be able to provide really a full range of services in the world of pain. Beyond pain, are there other things that come into play here?
Well, usually pain is what drives patients to our office,
Okay.
but also their inability to perform their activities of daily living,
Okay.
inability to go to the gym,
Gotcha.
inability to sit in their car, play with their grandkids.
Oh, right.
Just they're aging, and as they age, they get more inactive, and their lives become less youthful.
Right.
So our goal is to kind of turn the clock back, reverse aging,
Reverse the aging.
help patients forget their age,
Okay.
and become more youthful.
Gotcha. Now, when someone comes in, in a quick fashion, for anyone out there that might be experiencing pain or arthritis or old age and they're getting there, what kind of system do you put them through when they come into your facility?
Well, you know, it's a pretty standard doctor's office visit. Patients come in for a consultation. They go through that initial history and medical records collection. We spend 45 minutes to an hour discussing their individual problems.
You get to meet all the different folks.
And we have they get to meet our staff. But that process allows us to determine if they're a good candidate for cellular therapy or regenerative medicine.
Right.
So we're pretty good about getting an accurate diagnosis and then matching the diagnosis with the treatment.
Right.
Whether it's stem cell therapy or ultrasound or laser, whatever it is.
Well, it sounds like 36 years in the business of chiropractic medicine and now a number of years in the integrative regenerative side of the business, you're really situated very nicely to be able to help anybody out there that has pain or is getting older, having some of these issues. I'm a grandfather now, I've got 2 grandkids, and boy, you got to be on your toes to be hanging with the grandkids, right?
Yep,
so
that's correct.
For those that are out there that maybe have desire to track you down, what's the best way they can reach you and get a hold of you to come check out your facility?
So our recommendations is if you are facing a joint replacement surgery or a steroid injection, or if you're considering a rooster comb injection, any of these are temporary beneficial things that help on the current or short-term basis. But if you're ready to move to the next step and avoid surgery, avoid replacement, then you should pick up the phone and call the number that is indicated on the text below us. We'll be glad to see you as soon as possible.
Dr. Michael Gray, fantastic
Okay,
having you here
thank you,
today.
Kevin.
Keller Spine and Disc, and thanks for being here. And please take action. Call the number, visit the website on the screen right there, right now. Get a hold of Dr. Michael Gray. Thanks for being with us today. Take care.